about practicing resurrection. And as a witness to that resurrection, doing those things that affirm life. And as a church, collectively, we practice resurrection through our participation in the ELCA malaria campaign. Malaria has been around since ancient times, especially in the world's most temperate zones. Today, half of the world's population is at risk for contracting malaria. Even our troops deployed to Afghanistan need to take anti-malarials daily because they are at risk there. The 4 strains of malaria vary in severity. Plasmodium falciparum, the strain that is most prevalent in sub-Saharan Africa, is the most deadly. Young children and pregnant women are especially vulnerable, and death can occur in as little as 24 hours. But through our gifts to the ELCA malaria campaign, we are part of the great progress that is being made in this global effort to contain malaria. And I only have time to share one of many success stories with you. Anyat Michael, who lives in the Katakwi district of Uganda, recalls, "We used to bury so many people due to malaria, especially the children. The hospital was far away, and when the children got sick, it was impossible to navigate the difficult roads on foot to get to medical help in time. Parents didn't have the education or the resources that they needed to keep their children safe, and therefore many died." So, when the Lutheran Malaria Campaign began in Uganda, Anyat volunteered to join a village health team. He and his fellow volunteers were trained in prevention and control. And when they graduated, they received bicycles to help them travel from village to village in Katakwi to spread the word. Anyat's team educates people in the villages about what malaria is, how it is transmitted, and how it can be prevented. They distribute insecticide-treated bed nets, check with their neighbors periodically to make sure that the nets are being used correctly. The team also sponsors community events like clearing brush and removing areas of standing water where mosquitoes breed. They hold regular open clinics where sick people can come to be tested for malaria and to receive medication right in their own village. And if someone is too sick to even make it to the open clinic, the team makes house calls, a rare thing these days. Money from the ELCA malaria campaign, and that includes gifts that we have given, paid for the training that the team received. It also paid for the diagnostic kits, medicine, bed nets, and bicycles that enable team members to bring health care to the villages, many of which are in remote areas. And in most of those remote areas, the church is the only agency that is at work there. Anyat says, "We used to find it difficult to move from place to place to help community members. With the bicycles, our work is easier and we are able to reach every corner in every village to do our work. With this support, we are very determined to ensure that malaria is completely eliminated from our communities." Anyat is proud to say that through the health team's activities, the cases of malaria and its associated complications have gone down. These days, we hardly ever hear of a child who is rushed to the hospital with a severe case of malaria, and the children in Katakwi are no longer dying of a preventable and treatable disease. Anyat wants us to know that our gifts are appreciated. He says, "I and my colleagues are very thankful for the ELCA malaria campaign and the Lutheran World Federation for all the support that they are giving us. We are really very appreciative because malaria has been the #1 killer of our people." Anyat and his village health team are making malaria history in Uganda, and they are working together with our companions in Africa. Our gifts to the malaria campaign are part of this reversal, but more still needs to be done. A child still dies every minute of malaria, and that is far too many. Giving a gift to the ELCA malaria campaign is one way that we can practice this resurrection. The details of how to make a gift are on the bulletin insert that you should have received and on the back of that. And so I hope that you will consider making a gift to the campaign in one of those ways. Most importantly, through our gifts, we are the hands of Christ, affirming life and helping to make all things new for our brothers